So how have you been feeling after the baby?
I don't know. I've been feeling not really like myself. It's been like 2 weeks, I guess, and I don't know. I've been feeling kind of sad and like unmotivated. I was so excited, and now I just feel like I don't want to do anything but lay down.
That's pretty normal. I mean, parenthood is hard. There is, though, things to look out for. So during the postpartum phase, you might experience what's called postpartum blues or postpartum depression. I would say if it's past 2 weeks, it might be depression, which there's nothing wrong with that. It's completely normal to experience. So we're completely here for you with anything.
Thanks.
Have you had any thoughts of killing yourself recently?
Sometimes, yeah, like at night it gets bad, and I feel like I'd be better off if I was just dead.
Yeah. Do you have access to therapy, or have you been attending?
I have a therapist, but like I've missed some appointments, but I do have one.
Sometimes it's more convenient just to give them a call. I mean, I know, especially being a new mom, having to take care of baby and everything, it can take a lot of energy to just put that baby in a car seat and head to an appointment. So maybe just giving them a call. I would suggest doing it right now. That way you just have somebody more professional to speak to and having that option. Would you like to do that?
With you here? Yeah, let's call them.
Okay, great.
Okay. Elizabeth, are you feeling okay?
I've had a pretty bad headache all morning. I think I just need some more coffee.
Okay. Have you taken anything for it other than coffee?
No, just coffee.
Just coffee? Alright. How's your water intake been?
I've been pretty thirsty, but probably not keeping up on it as much. You know, the baby doesn't really let me put her down, and so then you have to go. So I just probably do need to drink some more water. My bottle's all the way out. So.
Okay. Well, I will get you some water, but I noticed that you're kind of like flinching your eyes as well. Is your vision okay?
So I don't think this is a thing, maybe, but I feel like it's kind of blurry and like light flashing every now and then. Maybe I'm just getting a migraine. I haven't had a lot of great sleep lately.
Because it almost sounds like you're having some signs of preeclampsia. Let's go over those signs real quick, okay?
Okay.
Let's give you a provider a call now just to make sure that we can maybe get you in sooner rather than later. I mean, it wouldn't hurt to make sure that you're not experiencing preeclampsia, because that's something that you can experience even 6 weeks after you deliver.
I didn't know that, so yeah, I definitely let's call the doctor. Okay. I go to ABC Clinic. Can you call them?
Of course.
I don't know. One of my older kids ran with the phone.
It's okay.
How's breastfeeding going?
I don't know. It's weird. I feel like the baby might not be latching on well, and I don't know if you noticed when you observed, but the milk kind of comes out through the sides, so I feel like a lot of it's being wasted.
I did notice that. And I did notice his mouth wasn't really having a good latch. Like it seemed kind of shallow. Is it painful at all when he's nursing?
Yeah, sometimes.
Okay. Now, I would like to refer you to Baby Cafe so you can kind of get a higher level of care for lactation support. They have breastfeeding experts, IBCLCs, where you can have a private consultation with them. It's totally free. And she can kind of look and see if there's maybe a tongue tie or some other concerns that might be the reason why milk is coming out. Would you be interested in setting up an appointment?
Yeah, I'd like that information.
Okay, great. And I can come with you too.
Okay, awesome.
Great.
Okay, so we have a few more weeks to go before baby comes. Have you thought about your feeding plans?
I think I want to do formula, like either Gentlease or, one of those ones that WIC gives, maybe.
Okay, so is there a reason why you are choosing formula before even trying breastfeeding?
Breastfeed? I haven't really given breastfeeding a thought. kind of nervous about that. I don't know about the idea of a whole baby like latching on to my nipples.
Okay. So, are you opposed to the idea? Would you like to learn more information about the benefits of breastfeeding for both you and the baby?
Sure, why not?
Okay. So, there's a lot of benefits, especially that first amount of breastfeeding. And signing on to say, I'm going to breastfeed doesn't mean you have to do it forever. But if you don't try, you're not going to be able to do it later.
But what if it hurts?
Well, so if the baby is latched on properly, it won't hurt. It might be uncomfortable, but it shouldn't be painful. And we have a whole team of doulas, myself, whoever's in your labor and delivery room, because we operate an on-call system. But we're all trained to help with that first latch and help make sure that the baby's positioned well so that it doesn't hurt.
Okay, wait. Okay, so I get that my baby's getting fed, but like, well, can you just let me know like what are some of the benefits? Like what are some of the the ups, downs, or whatnot?
So some of the benefits include, for the baby, the nutrition. It helps with their immune system. It's easy to digest, so they have less tummy troubles. For you, though, which this is a big thing that often moms, we think about the babies, not about the mom, but for you, it helps reduce your risks of certain cancers. It helps burn some extra calories, so you'll continue to burn those calories. And it can help especially with the bonding, because you'll be snuggling your baby all the time. It helps regulate some of your hormones. So there's just a lot of good stuff there for you and baby.
Oh, that's exciting. Okay. I think I'll give it a try.
Okay, so how are you doing?
I'm doing good. I think I'm ready. I'm just trying not to psych myself out.
Yeah. So what are your plans for like managing pain or anything that might happen during labor?
I know we talked about a few things, but I looked into a little bit more about the epidural. I don't think I want to do it. I want to try doing this without the epidural. Maybe you helping me walk and whatever else I can do. But I want to try to not get the epidural.
Good. That's fine. It's a good plan. I'm always down to help you, and I'll be there throughout your labors to help you as much as I can. So
I'm gonna need that.
we're waiting for this.
I'm gonna need you to help me with the walking, and because my mom's gonna be in the room too, and she really, really wants me to get the epidural because she had it, and she's like, "You're gonna need it," and I really need that confidence boost to make sure that I can do it on my own.
Yeah. And regardless, we'll be here for you, both your mom and I. So we're gonna encourage you as much as we can. Well, I'll talk to her and everything so that she can see too that sometimes comfort measures without medication are very helpful as well. So once time comes, she'll actually start seeing the changes, and will hopefully be a little bit more relaxed about it and more confident in your strength.
That helps because I'm really worried about what my mom's gonna convince me to do.
I think she'll be okay, and you'll do just fine as well.
Thanks, that helps a lot.
How's everything going?
It's tiring. I can't get her to go to sleep. She's constantly fussing. If I even move the wrong direction, she is just not having it at all.
Okay. Have you heard of the 5 S's?
I can't even think straight. What's the 5 S's?
So there's this method. It's called the 5 S's, and it is designed to help cue the baby's calming reflex when they're newborns. So the first thing we're gonna do is we're gonna swaddle her. Okay, can I try this and show you? Okay, so we're gonna take her out of this swaddle and put her in this swaddle down here and make it a little tighter for her. Babies like to feel the way they did when they were in the womb, so they like to be nice and tight. Of course, yeah, they kind of complain at this part here. This is a nice swaddle blanket you have.
Thanks. This is my first time even really using it. I had it out.
Right, it's here. Oh, see, so she's getting in there all nice and tight. So, and then we're gonna move her to her side. So you can move her like this. So go ahead and position her like that on her side.
Like this?
Yeah. So you're supporting
not
her
gonna
head. Nope, you've got it right.
Okay,
You support her head. And then the next one is shushing. So yeah, and sometimes it has to be really loud. Yes. And then you're already kind of doing the swaying or the swinging. Okay, great.
It seems like it's working okay.
And then does she take a passy?
Sometimes. It's hit or miss. We could try it.
Okay, and this, because the last one is sucking. And now that she's calm, you'll be able to lay her into her bassinet and just kind of do it slowly. Put her on her side first. Once she's calm there, move her to her back, and she should stay sleeping a little longer.
Thank you so much. Oh my gosh. I want to take a nap after this.
Okay.